Now back to Girl Talk with Julie and Nicole on KTRS.
Welcome back to Girl Talk on the Big 550 KTRS. It is the holiday season, and we love this time of year. It's Julie Buck, Nicole Genovese, and Matt, the MD Dorman. We call him the doctor. The doctor of radio. He is our one man that is brave enough to be right here with us on Girl Talk each and every week, and we're so thrilled to be with you. Our guest this segment is Cheryl Hazen. She's a registered nurse, and she works with Dr. Brock Ridenour. Now, I don't know if you heard of Dr. Brock Ridenour. I certainly have, and I know Nicole has.
I've heard of him.
Yes,
I have.
He is a plastic surgeon, and he's the best in St. Louis. First of all, Cheryl, welcome to the show.
Thank you. So good to be back.
Yeah, we're glad to have you back. Last time you brought some needles. This time
I did.
I know.
I came empty-handed this time.
Next time, you just
Next time.
bring some syringes or
I'll
something.
just bring a little in my purse.
Whatever
bring
you
it.
got, we'll take.
We got cream, anything.
Between me and Nicole,
Fabulous.
we got a place to
Little
put
grab
it.
box.
We got a wrinkle here. We got a little
We could do
something
some
there.
Botox on Matt.
I don't want it.
That might be kind
Hilarious.
of fun.
That
want
would be
it.
fun.
I don't want to waste it on Matt. He's in his 20s. We're people
Yeah,
in
no,
need
yeah.
here. We're middle aged.
You guys are in your late 20s.
What is
Yeah.
there a shortage? Is there a shortage of Botox because of us?
I'll keep you looking younger than him. How about that?
Okay,
Ooh.
There we go.
And she is not kidding. She really is the best. So I want to share my little journey with all this stuff. Okay. You know, as we get older, I used to never understand my mom when she'd be like, oh, those wrinkles. I'd be like rolling my eyes. And then sure enough, you know, I don't even know how old I am.
46.
I'm 46. Nicole's 47. And then all this stuff starts to happen. And now there's, you know, like your mom said to me, Nicole, I would have done this stuff if it was available when I was in my 40s, but it wasn't. But now there's so much available. And I used to go somewhere else for filler or Botox, whatever I could get my paws on. But now I go to Dr. Brock Ridenour's office, and I've worked with Cheryl and Sarah. And the difference to me is, and I told Sarah this yesterday, I was in for a little visit.
I know. I'm sad I missed you.
I know I missed you too. But I just can't get over the difference with Ridenour plastic surgery. And this is the honest to God truth. How much time and how much thought you all put into everything that you do.
We do.
I mean, it's very thoughtful, meaning they really study your face and look, because everybody's different, right?
Right. Everybody is made differently. Everybody, depending upon what treatments you do, you know, takes a little bit something different to help keep them looking natural. So it really is an individual basis on how you're going to achieve the look that person is looking for.
And everybody doesn't look the same.
They don't.
You know, like a lot
Anatomical
of these places,
differences, things like that. So
everybody comes out and they all have the same lips, the same
right.
cheekbones.
No cookie cutters.
And
no
we all
cutters.
know where they went. But I want
Right.
to tell you
Right.
that those of us that know who looks great, like I saw another friend of ours that I guess because of HIPAA, I don't know if I'm bound to that, but I saw a friend of ours that I know is another patient at Ridenour Plastic Surgery, and she's kind of a well-known person here in St. Louis, and she looks amazingly natural, and it's unbelievable. And I just, it blows my mind with the stuff that you can do with no downtime
right.
these days.
And we don't want you to look like you've had quote unquote work done.
Right.
That's not a good result. We want you to just look your best naturally. And we want you, when people come up to you and say, man, you look great.
You want you to look like you.
Yeah, and then to be like, they're like, well, you don't have any work done. Be like,
Right.
actually, yes, I do.
Yeah. This whole thing is work. Honey.
There's a ton of work on this,
Yeah,
but you
no,
would never know it.
Exactly. I mean, you know, you don't want to look like the cat lady. You want to look like
No,
yourself. And
exactly.
Well, and the other thing that I have to mention, and this is just your pricing is way better than anybody.
We try to keep it fair.
It's so
because
fair.
we want you to come in and enjoy not only the look that you like, but it to be affordable as well.
That's why I can come every 2 weeks.
Right.
It's like getting my nails
I love
done.
seeing you anyway.
Don't tell her husband, but yeah, no,
Yeah.
He knows.
really is.
I think he might see me go up.
Because Ridenour Plastic Surgery is in the Genovese Jewelers building, just west of 270 on Creve Coeur on Olive. So, okay, I was talking to Dr. Ridenour's wife yesterday, Leanne, and we were talking about a couple of things. One, I think it's really cool that he was chosen to be the North American representative to go to Paris to teach doctors about being a facial plastic surgeon.
Well, he's actually going to speak on behalf of Cineron, which is a laser company. He actually leaves this weekend, and he's going to teach doctors about a treatment called Profound.
And what's that?
It's a device. There's 2 different applicators, but it's for skin tightening. So one does skin tightening, and we use it a lot on the face and the neck for people who are not ready for surgery yet, but want a little bit of visible tightening, improvement in their skin, their elasticity, which is good. And then the other hand piece, we use it a lot in the body because it helps tighten skin, but it also will do a little bit of contouring, which is also nice.
The fact that he was chosen to be the North American representative and go to Paris and do that, and then I know he's going to New York later in the month to speak to more doctors about procedures. I mean, that says a lot. We're lucky to have Dr. Brock Ridenour right here in St. Louis. So another thing that we talked about yesterday at the office was the micro infusion.
Oh my gosh, I love this treatment.
Aqua Gold. And so we were talking about the value of facials because I love facials, but Leanne right now was saying facials are great. And it's like getting a massage. You love the time that you spend to have for yourself to relax and, feel good, and it's fluffy and nice. She said, but if you're really looking to like get bang for your buck, so to speak,
this is the best.
This Aqua Gold is the way to go.
It's amazing. We just brought it into the office maybe a couple of months ago. And so it's this little container that has 24 karat gold pins. And these pins are smaller than a strand of human hair. And they infuse whatever products you put into this canister. And so what we use Botox, because Botox is the only thing clinically proven to shrink pores. It paralyzes the small muscle that's attached.
Nicole.
I know, right?
And the doctor.
My
You're right,
strawberry
and the
nose
doctor,
over here.
right?
Don't
See,
look
there
at
you
it.
go.
She's looking at me right in the nose. I don't like it.
Botox is the only thing proven to shrink pores because it paralyzes that little rector pili muscle that makes your hair stand up when you get goosebumps. Mm-hmm. It paralyzes that and it shrinks the pores. It's the only thing proven to do that. We also put a little bit of filler, which kind of it plumps the skin. It kind of fills in all the little crinkles and creases. Where I notice it the most is around the eyes and mouth, which is where every place women hate.
So do you still need
you still need filler and you still need Botox because this is only going into the skin. Right? When we do Botox, we're putting it deeper into the muscle to stop muscle movement.
I knew that.
All right.
Getting good at
I know,
that.
right? Or when we do filler, we're putting it either on your bone or just above the bone so that it's at a deeper place. So it doesn't take the place of that.
So, Cheryl, when you see Joe, that's what I want for Christmas.
Okay, I'll tell him.
Joe is Nicole's husband.
Yes.
I'll give him a little hint. And the other thing we put in is a really powerful antioxidant, which is pretty amazing because it's going to help with sun damage and it's also going to help with redness in your skin. I did it one of my first.
This is like a miracle.
It's amazing. I did it. One of my first patients. She had quite a bit of sun damage over her nose. She had some redness in her cheeks. Redness in her chin. I saw her a week later, and she said that 5 of her friends had come up to her and said, "Oh my goodness, what are you doing to your skin? Because it looks amazing."
So honestly, if I come in on Monday, let's say, could I go right to work without everybody here hassling me on what have you done to yourself this time?
We only ask that you don't wear makeup the day of treatment.
Yikes. Okay.
So if you want to come in at the end of your day
and just wash the makeup off.
Just wash the makeup off, and then since you're going home anyway for the night, and then the next day you look like you've had nothing done, you wear makeup, you go about your business.
Can you put this on your chest, or is it just for
Nope,
your
you
face?
can do neck,
'Cause
you can do chest.
You know how red and bumpy and
Yep.
Yeah.
That sounds lovely on the radio.
I did it myself.
I'll show you a picture.
It's like a topographical map.
It's like connect the dots.
I was one of the first people to get treated when we first got this. Mm-hmm. And so when I got treated, the treatment takes about 8 minutes. It's really very quick. It's not painful.
Doesn't hurt.
It doesn't hurt, which is great.
Yes.
Love that part.
You look a little pink maybe for about 15 to 20 minutes afterwards, and then nothing.
That is crazy.
You don't
And
have
then
to.
When do you do the next treatment? And do you have to do several treatments in order to get a result?
Great question. So there also is one other medication we can put in this treatment for people who have melasma, which is that smudgy pigment.
Mm-hmm.
Oftentimes you'll see in pregnant women where it kind of looks like they have dirt on their face.
Do I have that?
No,
Okay.
you don't.
Okay.
Sometimes, a lot of times you'll see it either as like a big spot on the
Like a
forehead.
birthmark type looking thing?
Yes, or like you'll see it a lot on women's upper lip where it looks like they have dirt on their upper lip.
Or a mustache?
Or a mustache, yeah. And so we can put a medicine called tranexamic acid in there, which helps with pigmentation. And when we do treatments for melasma, then yes, that works better if you do it as a series, like maybe one treatment every couple of months. Technically, you only have to do this treatment once every 3 to 4 months. So it's pretty...
Julie, I think we should just check in.
I know,
for a
right?
week. Like, that'll be our spa week.
I know, right?
Can we go now?
Yes, yes. It's great because it really doesn't take very long.
Okay, well, I'm going to see if you can take me
It's
before
amazing.
Christmas. I would love to try
It's
this.
amazing. It takes about a week to see results, but I did a picture, right before and then a picture a week out, and the improvement in my skin in terms of the redness and the pigment is pretty awesome.
What about for older people? Like my mom loves to do this kind of stuff. I mean, does that make a difference for somebody that's in their 70s?
They still get a plumping of the skin.
Okay.
You tend to see a more wow, I would say 60 and under, but they still get a great result because you're just doing something to keep your skin looking vibrant and healthy.
A moment ago, you were talking about some skin tightening things, and I'm going to be going on a honeymoon, in April, maybe May of next year. And I was wondering, is there any way we could put something like that on my stomach area, like on my abs? Because
we could just get them airbrushed on.
Yeah,
Oh
right.
God.
You know
Spray
what?
tan.
There
I
you
thought
go.
about it. I want to look good on the the pictures on the beach or wherever I'm going to be.
Actually, the profound device that he's going to be speaking about, the what we call the sub-Q applicator, which I know makes no sense to you guys, but it does do body contouring. Oddly enough, we actually hosted about 10 doctors in our office about a month ago to host a clinic day where different doctors came in for more advanced treatment techniques. That was one of the treatments that we did on 2 of our staff members.
Is that what I did? Remember?
Yes.
I did something like that for my stomach.
No, not that one.
Not that one.
Not that one.
Wow, that's a secret you kept from me.
I didn't want to say anything.
We'll talk later.
I thought she
But
looked like a Spartan.
It was
but I didn't.
so it was kind of cool. I did one of the girls' abdomens, and she says, "Well, I want an ab crack," and so I kind of did some contouring, and she's 2 weeks out, and she has an ab crack. So
An ab crack. I've
like
never
where
even
a crack
heard
goes
of
down the
that.
middle, where you can kind of see like the abs.
Does she work
yeah.
out?
Yeah.
I
No
give
working
up.
out?
No, she doesn't really work out.
Okay, I need an ab crack.
I know, right?
You don't need an ab crack.
Yes, everybody needs an ab crack.
At this age, we need to worry about the face.
All right,
Right.
we're going neck up.
Okay, yeah, exactly.
Right. You see this every day, right?
Right.
We gotta keep it looking good.
That's what turtlenecks were invented for.
That's
by the way.
right.
So Cheryl Hazen is our guest. She is a nurse at Ridenour Plastic Surgery. Dr. Brock Ridenour, the best in St. Louis, in Creve Coeur, just west of 270 on Olive in the Genovese Jewelers building. The place to go. I mean, when you go in there, everybody's super friendly. And when people hear you talk, Cheryl, I like to let people know, too, that you are actually in surgery with Dr. Ridenour. You're not just you're not just talking here. You really, know the whole deal. Like
Yep.
you see everything that goes on. And,
It's so fun.
And he's amazing.
He's very good. Lately we've had a few patients come in. We've done a few rhinoplasties, which is operations of the nose. They look so good.
He's an artist.
Oh my
really.
goodness, he really is. And it's fun to be a part of that process, to see the before, to help with it during the surgery, see it after, and get to see it then before we put the cast over the nose, where they have to have a week of healing.
So you sort of know what it's going to look like.
Yeah, and so it's so fun because when they wake up and the first thing they always say is, "How did it go?" And I'm like, "Oh my goodness, you're gonna love your nose. It looks so beautiful." Before we put the cast on, and they get so excited.
Which
it's
is
so
such a
fun.
game changer
Oh my
for
gosh!
women.
Because most of these
and
patients
men.
have been thinking about it for years because they've hated their nose for years, and then to just see that look of relief, like, "Thank you, I finally got this done, and I know it's going to look great." It's so rewarding.
The other thing we talked about was sometimes people that will go somewhere else for a rhinoplasty, aka nose job, then it didn't go well, and so
Right.
they will go to Dr. Brock Ridenour to revise it and correct it.
Do you know, we've had a couple people actually recently come in and say, I've had a rhinoplasty in the past and I wasn't very happy with it. I'm still bothered by this. I actually went to go see another doctor in town, and he told me he wouldn't help me or he couldn't help me, which is really disheartening to me because I think if you're still bothered by it and then to just be turned down by somebody else is frustrating.
Right.
So, and he's really great at doing that. I mean, he knows the anatomy well, and he just has a really great aesthetic eye. And so it's fun to be a part of that process.
And not an extremist.
No.
So you're not going to look completely different.
No. And I
Once
think a lot of
again.
people worry about that. And he doesn't do cookie cutter noses ever.
Right.
I mean, he looks at each individual patient. He looks at their ethnicity, their face shape and what's going to look best on them, and goes from there.
Well, for the holiday season, a great gift idea, honey, if you're listening.
Yeah, I know, right?
Is a gift certificate to Ridenour Plastic Surgery, because you can put those dollars toward anything you want.
Exactly. And we are just getting this set up where you can actually purchase a gift card on our website now.
Oh, cool.
And we're going to
that makes
you're going to
it
be able to
easy.
do it on Instagram and Facebook as well. We'll have a link up so that if you just think, hey, I don't have time to run in there today, get on our website.
That's huge.
Say who you want to send it to and how much you want to send it for, and we'll send it out right for you.
That's your Christmas gift.
I know.
Julie.
See, there
I'll
you
buy
go.
you one and you buy me one.
Exactly.
Check the box. Done.
Done. Christmas gift.
Done. All right. Cheryl Hazen from Ridenour Plastic Surgery. It's always a pleasure to have you on Girl Talk, and
I love hanging out with you guys.
It's always fun to just hear the latest and greatest that you guys have in your office, because it seems like whatever the cutting edge technology is,
We're doing it.
you're doing it at
Yep,
Ridenour
we're doing
Plastic
it.
Surgery. What's the website?
www.ridenourplasticsurgery.com.
And you can get the gift certificates there as well.
You can, or on Facebook and Instagram too. We'll also have a link up on our webpage or our business
media.
sites, social media sites as well.
Okay, cool.
Perfect. Thank
All right.
you.
Well, happy holidays
Thanks, ladies.
to you,
Happy
my friend.
holidays.
Yeah.
We'll be back with more of Girl Talk in just a sec on the Big 550 KTRS, the talk of St. Louis.